Now let's talk about cytokines and environmental chemicals. According to a report by the World Health Organization published in 2020, major pollutants include particles matter, such as small diameter particles, PM2.5, or smaller particles than that are generally more dangerous. We're also looking into carbon monoxide, ozone, nitrogen dioxide, and sulfur dioxide. Air pollution causes an estimated 4.2 million premature deaths worldwide every year. Increased mortality from stroke, heart disease, chronic obstructive pulmonary disease, lung cancer, and acute respiratory infections. And about 99% of the world population is living in urban areas with air quality levels that exceed the World Health Organization guidelines limits. So let's take, for example, heavy metals, which are very common in our environment, food, and even water. Animal studies are showing that exposure to environmental chemicals, such as heavy metals, the heavy metal lead, increase the expression of interleukin-6, while exposure to subtoxic levels of cadmium led to a cytotoxic storm, producing reactive oxygen species and nitric oxide, upregulated the expression of pro-inflammatory cytokines, and suppressed anti-inflammatory cytokines IL-10. So you can see how being exposed to lead that is found in our water or found sometimes in children's toys and other places in our environment. Sometimes it's in old houses that are built before 1978 in the United States have lead in their paint. And so lead and also low level exposure to cadmium might lead to ongoing activation of those cytokines. In a study published in 2020 with 147 preschool children, reported that levels of lead correlated with increased levels of cytokines interleukin-1 beta and IL-6, while increased levels of cadmium, mercury, and arsenic correlated with lower levels of anti-inflammatory cytokines. So you can see on one hand, with heavy metals, we have an overexpression of the inflammatory cytokines and suppression of the anti-inflammatory cytokine, which is a recipe for ongoing inflammation, ongoing damage, and possibly an autoimmune condition. And when we look at BPA and pesticides, animal and cellular studies reported that exposure to pesticides and insecticides led to an increased levels of interleukin-6. Exposure to bisphenol A, BPA, found in plastic bottles and containers was reported to decrease the function of T-regulatory Treg cells and upregulating pro and anti-inflammatory cytokines and chemokines. These are just presented as examples for the mechanisms of how BPA found in plastic and leaking into our water or food, and pesticides that are sprayed multiple times over conventional grown vegetables, fruits, could continuously aggravate an autoimmune condition or inflammatory condition. And it's important to remember that, because when you see patients, if you prescribe an anti-inflammatory protocol or a medication or steroids, and you're addressing the condition, you're addressing the symptoms, but if we don't take the time to educate the patient about those mechanisms and they keep exposing themselves to BPA, exposing themselves to pesticides and other chemicals like heavy metals, they essentially keep retriggering, reactivating the same inflammatory pathways. Another study in 2016 reported that several studies indicated that chronic exposure to pesticides, even at low dosages in agriculture, commercial, domestic, and garden administrations, is associated with an increased risk of cancer by several mechanisms, including influencing the activity of natural killer and natural killer T cells, macrophages, cytotoxic T cells, and cytokine secretions. And those are really important in fighting tumor cells and other pathogens that might lead to infection. And promoting chronic inflammation, influence tumor immunogenicity, and suppressing anti-tumor immunity. Here are some of the citations.